Hi, my name is Wendy Tabor Booth, and I am a grief counselor from Ethos Hospice in Fargo, North Dakota, and I also serve as I'm the bereavement coordinator. And I hope all of you who are viewing this and watching this are doing well and taking care, especially during the times that we are in right now. I'd like to tell you a little bit about the Ethos story. Ethos Hospice and Home Care was established in 2014 by Bethany Retirement Living, Eventide Senior Communities, and Knut Nelson out of Alexandria, Minnesota. And these partners came together to form Ethos Hospice and Home Care because each one of these partners, along with ourselves, possess similar values and are committed to achieving a higher level of care and quality of care for our clients. Ethos is a nonprofit organization. We are also faith-based, and that is an important part of who we are, is our faith-based entity. Our mission of Ethos Hospice is to enrich the quality of life for those that we serve. And I like to believe that we do that every single day. So let's talk a little bit about hospice. What is hospice? Hospice is a special kind of caring. It helps people who are experiencing a limited life expectancy. We help these people live as well as possible, focusing on the quality of their life. There are many misconceptions about what hospice is. And many times people will think hospice is a place. And while we do have a hospice office, the term hospice is not a place, but it is a philosophy of care, recognizing that everyone deserves to live out his or her life with respect, dignity, free of pain, in an environment that enhances their quality of life. So hospice is a philosophy, not necessarily a place. Where can hospice be provided then? Hospice care will come to wherever an individual lives, wherever they call home. Home might be an apartment building. It might be a long-term care facility, such as a nursing home. It might be an assisted living facility. There are times where we have had referrals made for people who were homeless, and we would admit those people and help them find a safe place to live and to live out their last days in comfort and in a place of safety. So we will go to wherever that person calls home. Hospice is made up of an interdisciplinary team. We have a holistic team approach to our care, and it's made up of many different disciplines. So we have a medical director, which is our physician that oversees the hospice plan of care. We also work very closely with an individual's primary care doctor. We have nurses who are assigned to our patients to ensure that the well-being, the physical well-being of those individuals are cared for, that they are free of symptoms, that we are monitoring any type of pain or distress that someone might be in. Our nurses are on top of those situations. And it's also important to note that hospice has an on-call system, is what I should be saying, where we provide 24-hour nursing response care to patients should there be an emergency. It is an on-call system that is 24 hours a day, 7 days a week. And if a patient is in distress or if a family member has a concern, we can come out and address that regardless of the time of day or time of week. We also have social workers that are on staff. Social workers can help provide support and resources to family members and patients, resources on maybe community resources. If there is help they need financially, we can refer them on to those entities, maybe Meals on Wheels, maybe additional care to be hired in. If there is a lack of of caregiver in the area, we can provide a lot of different services and a lot of different referral sources to those patients and their families. A social worker can also help process with the families what's going on with their loved one. Dealing with end of life is not always easy. It's something that can be very stressful and something that can be very beautiful all at the same time, and our social workers can help with communication amongst family members to bring people together, maybe for reconciliation, and just to provide that ongoing support. We have chaplains on staff. Because we are a faith-based community, our chaplains are very important to us, although we are very careful to always meet patients where they are at in their lives. Maybe there's not a spiritual source of support that they rely on, and maybe there is, and our chaplains will meet our patients right where they're at, and also help those individuals stay connected to their church community, to their faith community, and in communication with them, make sure that their spiritual needs are being addressed at this very, very sensitive time in their lives. We also have volunteers that we can offer, and our volunteers can visit for companionship. Many of our patients on Ethos Hospice are in nursing facilities or nursing homes, and we have volunteers that enjoy spending time with them and providing socialization and visiting and helping with reminiscing and just being with that patient to provide a piece of that quality of life. We also have a volunteer who does massage therapy. That is something that we offer at Ethos Hospice, is massage therapy, and also pet therapy. We have a couple of pet therapy volunteers, and those canines really make a difference in people's lives. Our volunteers are very important to us, and we continue to seek out new volunteers for training and to get to just be a great part of people's lives who are on our service. We also have home health aides who can help with those intimate personal cares, bathing, dressing, grooming, feeding assistance, those types of services that are important on a day-to-day basis. And then bereavement support. And that is where my role comes into play. I am the bereavement coordinator with Ethos Hospice, and my role is to follow up with families after the death of a loved one and to provide grief support and resources to them. Medicare requires that we provide grief follow-up services to our family members for 13 months. And the reason it's for 13 months is to see that family member through that anniversary date of death, and a little bit beyond, just to make sure they're doing okay and that they have the support resources that they need and that they need in their lives to help them through the many firsts after a loved one dies, whether it's that first holiday or that first birthday or that first anniversary. We want to be able to walk alongside our family members to provide that support. Bereavement support is a choice. Many people choose not to receive bereavement support, and many people choose to receive it. And most of that depends on that person's support networks. So there are some myths to hospice that I thought important to note. One of the first myths that I just will mention is that that hospice care is for people who have cancer. That is a myth. While we do serve people, we have people on service with cancer, there are many other end-of-life conditions that can deem a person eligible for hospice care, whether it's end-stage Alzheimer's, Parkinson's, cardiovascular disease, congestive heart failure. There are many other conditions where that lead people to end of life other than cancer. So that is just important to make note of. Another myth that I think is worth noting is hospice means that we're giving up. And that is not so. Hospice is hospice care is available to enrich the quality of life of that individual and their family, to make sure that they are symptom-free and that the relationships that they have with their loved ones are ongoing and encouraged, and to give that patient to validate that how they lived and that they lived really mattered and really still matters. Many times people who come onto hospice care actually end up doing a little better in their end of life disease process, because we are a stable force coming in regularly to make sure that they are doing okay and their symptoms are monitored and they are free of pain. And many times we just see people do well, and that's a good thing. And also many times we see people graduate from hospice care where they no longer meet the criteria of being at end of life, and that is a good thing too. So those are a couple of the myths. And the one I was also going to mention is that hospice is a place, and we talked about that earlier, that hospice is more of a philosophy of care. So hospice care provides support to both the dying individual and the entire family. And as I mentioned a little bit earlier, I'm the bereavement coordinator with hospice, and I'm here to talk a little bit about changes in our life, especially with the social distancing that we are undertaking at this time due to the pandemic. We have been in uncertain times these past couple of months. The coronavirus pandemic and our need for social distancing has been our focus each day. Simple tasks such as running to Walmart or Target or the grocery store, maybe running to the post office, going to church, meeting a friend for coffee, having face-to-face interactions with people. We aren't seeing that all that much anymore. And we are grieving the loss of our normal lives, and many things have changed. And we hope to see that open back up, and we hope that there's a time where we will feel connected again. But I just want to talk a little bit about change. Change is a given in our lives, and change can look many different ways. So I've worked in the realm of hospice care for almost 30 years, and several years ago, I used to meet with elementary school kids and talk about change and loss. And so one of the questions I would ask is, what kind of changes have you gone through in your life? And so I ask you, think about what kind of changes you have gone through in your life. And what do they look like? I know the kids would always say, I got taller. I am going into 6th grade now. My eye color changed, my hair got longer. So all of those physical types of changes. And while those might not be the changes that you and I are thinking about when I ask that question, they are still changes for these kids. And then I would dig a little deeper. Think about your family and just your life. What kinds of other changes have you gone through? And these might be the changes that you are thinking of. Maybe there was a death in the family. Maybe mom and dad got divorced. Maybe you are going through a difficult change right now, and maybe that is a divorce. Maybe there's financial hardship, especially given the time that we are in. Maybe there has been a job loss. Maybe you've had a decline in your health. Those are lots of changes, and those changes are significant and can cause us to experience many different feelings. And those feelings might be feelings of loss. So when someone we love dies, we have feelings of loss, feelings of grief. But even when significant things happen in our life, such as the significant changes along with social distancing and the pandemic, we also have losses that come along with that too. The loss of human contact, the loss of seeing loved ones that we're close to. also important to note is that changes in life can be good and changes can be not so good. And changes that might be good, kids will say, we got to move into a new house. I got a new baby brother or sister. I got to have my own room in that new house. But there's also stress and feelings of anxiety that can come along with those good changes. Just trying to balance both of those out, that changes in our life can be good and not so good. And with any change in our lives, they are accompanied by some feelings. And what are those feelings? And that's a question I ask those kiddos. What did you first think or feel when that person that you loved died? And one of the first words that they'll say is sad. And I think that can be true for both you and myself. The feeling of sadness. What are other kinds of feelings that you felt when you first found out? There's anger. Anger can be felt. It's not fair that this person was gone too soon. We all know that death can happen at many different ages, from infancy to elderly. And how those feelings that we have are based on the relationship that we had with that person. Were we close to them? Were they a part of my family? I miss them so badly. And those are those deep feelings of grief. Another feeling, relief. Now, when I would bring this feeling up to kids, they would say, why would anyone feel relieved when someone dies? And I would ask back, why do you think they would feel relieved? And one of the children there was always a child in the classroom that would say, because then they're not suffering anymore. That's why we'd feel relieved. So that is a common grief reaction, that we would feel a sense of relief, knowing that that person is not dealing with the illness that they had, and they are no longer suffering, and that they are at peace. Another natural reaction to grief is guilt. Why might we feel guilty when someone dies? And many times I will hear people say, I wish I could have told them how I felt. I didn't get to tell them that I loved them one last time. I wish I could have shared this with my mom or my dad or my child before they died. I should have done more for them. Those are very common grief reactions when you're experiencing guilt. So there's a lot of different ways that we react to grief, and those are everything that we've talked about are called grief emotions. And I think that what we do when we're experiencing those emotions is very important. So how do we cope? What helps us when we are feeling those intense feelings of grief? First of all, it is so important that you recognize that those grief feelings are normal and they're common. They are common grief reactions for any type of a loss that we experience in our lives. They are normal, because many times some people might feel, I feel like I'm going crazy. I have all of these emotions going on inside of me, inside my head, inside my heart, and I don't know what to do with them. I feel like I'm going crazy. And there's actually an article that was written on you're not going crazy when you are in grief. So, so it's important for me to let you know that your feelings are validated, because they are normal grief reactions. But they don't feel good. And what can we do with our grief when we have those feelings? Well, the first thing is we can't run away from them. We may try to go under them or over them or around them, but grief is definitely something that at some point we have to go through. So we have to go through those emotions, and how do we do that? We do that with support and help from others. So I'd like you to take inventory of who it is in your life that you would talk with, that you would go to when you are in need of something. Quantity is not important here, it's the quality of the relationship that you have with that person. So I hope you're not trying to number as many people as you can in your mind. Think of those individuals, or just maybe there's one person that is your go-to person when you are struggling. Ask them for help. And really that help might be in the form of listening, of just needing someone to talk to and someone to listen to you and to listen to your grief feelings. They may be family or friends. Seek them out. Ask them for private time if you need it. Try to overlook statements that they might say that maybe aren't helpful. Be gentle with people who are trying to help you through your grief. They want to help and they want to fix it for you when we know that that's not going to be a possibility, but they can be there for you. So let them know what you need. I just need you to listen to me. I just need an ear and a friend to talk with. So reach out to those individuals that you might find support in. It may be family or friends. It may be someone from your faith community, a pastor, someone from the clergy. It might be a counselor or a coworker that you are especially close to, but please reach out to someone. Hospice provides grief support to anyone who is struggling from the loss of someone close. Ethos Hospice provides grief support to the community as well. So reach out to a local hospice if you are needing to talk with someone about your grief. Grief can look many different ways. So we've just talked about feelings. So I'd like to switch gears. Also, let me back up a step because I want to talk about the feeling of anger and the feeling of, sometimes there's feelings of hopelessness and depression. And please keep those feelings in check because we want you to be safe. We don't want you to harm yourself. And if those thoughts come into your mind, if grief feels like it's just too much, we need you to reach out to your physician, to reach out for help. And that might even mean calling 911, whatever it takes to make sure that you are safe. So I can't talk about this topic without mentioning that, the importance of that. So there are also physical symptoms that can come along with grief, and physical symptoms such as inability to sleep at night, lack of appetite, sleeping too much or sleeping too little, eating too much or eating too little. It can take on some psychosomatic feelings, feeling like a tightness in your chest, feeling queasy. When I talk to kids about those feelings of grief, how they feel physically, that is one of the most common things that they will say is, I felt sick to my stomach, and I felt scared. And those are common grief feelings as well. Body aches, stomach aches, headaches, lack of energy, feeling like you just can't get motivated to really do anything. Those are all very common physical ways that people might feel. When it comes to feeling off physically, I also recommend that you keep in close contact with your physician so that they know that you have experienced a loss, but also know some of those feelings that you're having, just to rule out that it's not something else that might be going on. Fatigue and exhaustion are very typical reactions. Thinking more about the person's death or illness than their life. How a person died can be very pivotal in how we grieve. The nature of the death. Was it a sudden death? Was it an unexpected death? Was it a tragic death, a homicide, a suicide? But also, given the time that we are in, with COVID-19 deaths happening, Was that a factor in how your loved one died? Maybe your loved one was in a facility or the hospital and you weren't able to be with them, or your time with them was very limited prior to their death. That may affect your grief. That may intensify your grief and your feelings and emotions that come along with that. It's just very important that you're aware of that. And it's important that you attend to your physical health. With all of the different physical reactions and emotional reactions that we have to grief, your physical health is all the more important. We can be very forgetful. We can forget to eat a meal. You might forget to have a snack, to make sure you're taking in fluids. So drink plenty of fluids. Eat small meals and snacks throughout the day, and try to engage in physical exercise. Maybe it's taking a walk around the block or going up and down the steps, but try to keep yourself moving and get plenty of rest. And one thing for adults and children that can help us in our grief is making sure we have a routine from morning until bedtime. Just a routine so that there is something that we have control over and something that is constant in our life when everything else seems like it's out of control. Those are important things to remember. So what helps us in our grief? That's a very frequent question that I will ask my bereavement clients. And it's a question that I also ask those students in the classroom. What helps you in your grief? Answers that I receive back are talking to someone, knowing that I have someone in my life that I can trust to share my grief with. What also helps is time. There's the cliche, time heals all wounds, time heals grief, and that may not be so. I think that things get easier, but I also think that grief is like a roller coaster, and we see that coined in grief information. Authors you'll see it in books and literature and information on grief, that grief is like a roller coaster. There are ups, and then there are downs, and there are ups and there are downs. So there's good days and there's bad days and there's not so good days. But I think what we see in our grief is that the wicked ride of the roller coaster tends to level out a little bit, whereas you might find that there are good days, and the good days might last a little bit longer, and then all of a sudden there's a not so good day. So the wicked ride doesn't seem so wicked anymore, and but that doesn't mean that you're not going to get hit with a grief burst, which is sometimes what it's called. Maybe that favorite song will come on the radio, or many times I've heard spouses who have lost a spouse say, when I go to a restaurant or when I go to the store and I see couples together, that's when it hits me. The grief burst comes, and it's more of an emotional time. So how can we take care of ourselves in grief, and what helps us? There are strategies that you can take to help yourself through grief. And the first one that's important, again, is talking to someone. Telling your story to someone over and over again can be a very healing process. I remember when my mom died in 2002. She died very suddenly. I was 34 years old, and she died of a heart attack. And my daughter and I found her. And that was a complicated grief process for me because it was unexpected. But having asked the question to me, I shared an office with another bereavement specialist, and she would turn around at random times during those days and weeks and months after my mom's death, and she would look at me and say, "What is today like for you?" And that made all the difference in the world. It was random, and it made me think, but it also made me think someone else was thinking about me and someone else was concerned about me. Even though I had a really great support system, that that really sticks in my mind after 18 years of my mom being gone, that someone took the time really just to get in my face and say, what is today like for you? And then just to be able to talk a little bit about it and then go on with our workday. So talking with someone, talking can be healing, and telling your story can be healing. Keeping a journal and writing can be very therapeutic for people, and there are a plethora of journals and information, especially on the websites, and also your local hospice will have information for you on how to keep a journal and different things that you might consider writing about in that journal. And they can be keepsakes and treasures for you and for your family years to come. Artwork and creative projects are widely being used right now. Utilizing spiritual practices through your faith community, exercising, and getting in touch with nature. There's something about being outside, taking a long walk, or just being outside and soaking in some of that vitamin D and through the sunshine. And so being outside. We talked a little bit about pet therapy for our patients, and pet therapy for people who are grieving can be equally as beneficial. Join a support group. There are many different support groups that are offered throughout our community that deal with grief and loss, and the specifics regarding grief and loss. There's infant loss support groups. There is spousal loss support groups. There are support groups for men who have lost a loved one. There are many different groups around the community and classes through our local churches and hospices that are there for you to help you through your grief. One of the last questions that I usually ask those students that I would visit with about grief is, how long do you think grief lasts? And kids love questions, and they love trivia, and they love to raise their hand and provide an answer to their best judgment and their best guess. So the answers that would come in would be pretty funny. 3 weeks. It takes 3 weeks to get over those grief reactions, to get over those feelings of grief. It takes a couple days. It takes a couple months, a couple years. And I just kind of keep listening to the answers until I know that one of the students in that classroom is going to say, I think it takes forever, or I don't think it really ends. And that's the answer I'm looking for, because grief doesn't end. We learn how to live life accommodating that loss. That loss of that loved one stays with us for the rest of our lives. And I believe that that is a reflection of the relationship and the love that we have had with that person who died. So it's okay that grief lasts a lifetime. And it's important that you take care of yourself. And it's important that you seek out help when you feel you need it. So be patient with yourself, be gentle with yourself, and take good care. And thank you for taking the time to listen